Hello and welcome back to Best of the Day from the 2013 meeting of the American Society of Hematology. We're talking about acute leukemia, AML, and ALL, and we're going to move on during this segment to talk about ALL with Dr. Farhad Ravandi from MD Anderson, and especially some of the data that's been coming out of the University of Pennsylvania and NCI and other places with the use of chimeric antigen receptor T cells targeted to CD19 and now some other surface markers. So, Farhad, tell us a little bit about this immunotherapeutic concept and how this idea was brought to fruition and what sort of early results have been seen.
So the idea behind this is that cancer develops as a whole based on the fact that cancer cells will evade the patient's immune system. And
Right.
so using these engineered T cells that are directed towards cancer cells, the investigators in many centers, obviously the studies from Penn generated a lot of interest last year and this year. Carl June's group and David Porter and Grubb. So they, as you mentioned, they obtain T cells from the patient, autologous T cells, and they transduce them with using viruses with a fraction of the CD19 antibody and engineered to combine with molecules that activate T cells, such as co-stimulatory molecules and zeta chain of the CD3. And this obviously makes these cells sensitive towards the leukemic cells that express the antigen, in this case being CD19. And obviously the initial studies that were reported in first few patients showed dramatic responses, and that's why that has generated so much interest. As you mentioned, Penn is not the only center that is developing this. Memorial Sloan Kettering, I believe Fred Hutchison. Our group also under the leadership of Lawrence Cooper, E.J. Spall, and Partok Kebriai have been developing this. So there were several presentations on this in this year's ASH, and again, they all were very exciting presentations showing responses in relapse patients, even patients who had relapsed following transplant. And there are different systems that are being developed. So the group at MD Anderson has a non-viral system, what they call a Sleeping Beauty system, that is being examined for them, even in the allogeneic stem cell transplant setting.
So they can expand this T cell population then to just reinfuse it and then seek out
so they obtain the T cells and expand them ex vivo, develop enough of the cell population, and then infuse it back into the patients.
And they persist in the patient?
And in all of these studies, especially with the virally transduced constructs, they do persist. These T cells persist long, and then essentially act as disease-fighting T cells or leukemia-fighting T cells.
It's really exciting to see the advances that are coming along in understanding of immune tolerance and the immune checkpoints and how to overcome that and sort of rearm the immune system to go after the malignant cells, whether it's solid tumors or leukemia.
Exactly.
It gives great hope for the future.
Exactly. As you mentioned, the potential for this is quite large because it's not limited to leukemias. It could easily be used in solid tumor settings as a form of immunotherapy.
Absolutely. Well, Farhad, thank you so much for spending time with us and taking time out of what I'm sure has been a very busy, exhausting ASH schedule as usual, and I hope you have safe travels home tomorrow.
Thank you very much.
You bet. And thanks to all of you for watching this segment of Best of the Day. There is much more to come this evening and tomorrow, so be sure to check back with us. Thanks again.